He was 21, an MMA fighter, a personal trainer. He said he felt amazing. 11 days later, he was dead. Not from a fight, not from an accident. From a workout. She was 29, a gym regular. She felt a crack in her neck during exercise. Weeks later, she was in a coffin. He was 38, fit, healthy, zero medical history. He collapsed in the gym. His aorta had ripped open from the inside. These people did everything right. They trained, they ate well, they showed up, and the gym killed them. Not because exercise is dangerous, but because 5 specific mistakes turned a healthy workout into a death sentence. Number 1. Pushing too hard, too fast. The silent muscle killer. In March 2025, Jake Sendler, a 21-year-old MMA fighter from Melbourne, Australia, collapsed during a bout. He was rushed to the hospital and placed in intensive care. Doctors diagnosed him with rhabdomyolysis. Rhabdomyolysis happens when muscle fibers break down so rapidly that they release a protein called myoglobin into the bloodstream. Myoglobin is toxic to the kidneys. In large amounts, it clogs the kidney's filtration system, causing acute kidney failure. Jake underwent multiple surgeries. He was placed in an induced coma. 11 days after being hospitalized, he died. He was 21 years old. His mother described it as a silent killer. Rhabdomyolysis can happen to anyone who suddenly increases workout intensity. A new gym member doing an extreme first session. A regular lifter pushing through an unusually brutal workout. A CrossFit athlete going all out on a competition day. Approximately 26,000 cases are reported annually in the United States alone. Symptoms include severe muscle pain that doesn't go away, dark brown or cola-colored urine, weakness, nausea, and confusion. If you see dark urine after a workout, go to the emergency room immediately. This is not soreness. This is your muscles dissolving into your blood. The rule is simple. Increase intensity gradually, never jump from 0 to maximum. Your ego might survive it, your kidneys might not. Number 2, cracking your neck between sets. You finish a heavy set of shoulder presses. Your neck feels tight. You grab your head and twist. You hear a pop. You feel relief. In 2021, 29-year-old Joanna Kowalczyk from the United Kingdom felt a crack in her neck during a gym workout. Concerned, she visited a chiropractor for an adjustment. Shortly after, she suffered a vertebral artery dissection. The inner wall of the artery in her neck tore open. A blood clot formed, traveled to her brain, and caused a massive stroke. She died on October 19, 2021. In 2015, 27-year-old Jonathan Buckaloo from Georgia went for a routine chiropractic neck adjustment. The manipulation caused a tear in his vertebral artery. He had a brainstem stroke. He developed locked-in syndrome, a condition where you are fully conscious but completely paralyzed. You can't move, you can't speak, you can't breathe on your own. You are trapped inside your body. He has lived in this state for over 10 years. The vertebral arteries run through the bones of your cervical spine. Every forceful neck rotation stretches them. 1 in 20,000 manipulations causes a dissection. But when you combine neck cracking with the elevated blood pressure from heavy lifting, the risk multiplies. In 2023, an Australian man suffered a stroke after cracking his own neck at home. No chiropractor involved, just his own hands. If your neck is stiff after a workout, use heat. Stretch gently, massage the muscles. Never forcefully twist or crack your neck, especially when your blood pressure is elevated from exercise. That pop you feel might be the last sound you ever hear. Number 3, holding your breath during heavy lifts. When you lift something heavy, your instinct is to hold your breath and push. This is called the Valsalva maneuver. It stabilizes your core, it helps you lift more weight, and it can tear your aorta apart. Your aorta is the largest artery in your body. It carries blood from your heart to the rest of your organs. During a heavy lift with a held breath, your blood pressure can spike to over 300 millimeters of mercury. That is more than double the threshold for a hypertensive crisis. At that pressure, if there is any weakness in the aortic wall, whether from genetics, an undiagnosed connective tissue disorder, or years of repeated strain, the wall can tear. This is called an aortic dissection. Blood forces its way between the layers of the artery. If the tear extends far enough, the aorta ruptures. You bleed out internally in minutes. The survival rate for a ruptured aorta is catastrophically low. A 38-year-old man with no medical history collapsed in the gym from a type A aortic dissection while weightlifting. He had been healthy his entire life. His aorta simply could not handle the pressure. Aortic dissection during weightlifting is not theoretical. It is documented in medical literature. Multiple case reports describe young, healthy athletes dying from this exact mechanism. You do not need to eliminate the Valsalva maneuver entirely, but you must control it. Exhale through the effort phase of the lift. Never hold your breath for extended periods under maximum load. And if you ever feel a sudden tearing sensation in your chest or back during a lift, drop the weight and call an ambulance. You may have seconds, not minutes. Number 4. Taking a hot shower immediately after training. In 2025, a young man in India collapsed in the shower immediately after an intense gym session. He was rushed to intensive care. The doctor who treated him, Aditya Damija, shared the case publicly as a warning. The diagnosis? A cardiovascular collapse caused by a hot shower after exercise. Here is the science. During exercise, your body diverts blood to your muscles and skin to cool you down. Your blood vessels are dilated. Your core temperature is elevated. Your heart is working hard. When you step into a hot shower, the heat causes your blood vessels to dilate even further. Blood pools in your extremities and skin. There is not enough blood returning to your heart to maintain adequate pressure. Your blood pressure drops sharply. This is called exercise-associated postural hypotension. In severe cases, it leads to syncope, which means you faint. In a shower, fainting means hitting tile, glass, or metal at full force. Traumatic brain injuries from shower falls after exercise are more common than you think. But in the worst case, the combination of extreme vasodilation and a still racing heart can trigger a fatal cardiac arrhythmia. Your heart simply cannot maintain a stable rhythm with insufficient blood return. It fibrillates, and you die. Standing in hot water, alone, after an intense workout, cool down for at least 5 to 10 minutes before showering. Start with lukewarm or cool water. Let your heart rate drop below 100 beats per minute first. Never go from maximum exertion directly to a hot shower. The transition can stop your heart. Number 5. Ignoring chest pain because you think you're too young. This is not a single case. This is a pattern. In 2025, a 30-year-old gym owner named Jared had a stroke. He was fit. He was healthy. He was alone at home. He was 30 years old. A 24-year-old man collapsed while playing tennis at a fitness center in Henderson, Nevada in 2025. He died. A 21-year-old medical student named Mohammed Faraj died in a university gym after an accident with a Smith machine in 2025. The belief that young, fit people don't have heart attacks or strokes is the most dangerous myth in fitness. Cardiac events in people under 40 are rare but not impossible. And when they happen in a gym setting, where people assume the person is just exhausted or dehydrated, the delay in calling emergency services is often fatal. Warning signs during exercise that require immediate action include sudden chest pain or tightness that doesn't go away with rest, pain radiating to the left arm, jaw, or back, sudden severe headache, sudden dizziness or confusion, vision changes, difficulty speaking, and loss of consciousness. If you experience any of these, stop exercising immediately. Do not try to push through. Do not sit down and wait for it to pass. Tell someone. Call emergency services. Every minute of delay reduces your chance of survival, and if you see someone collapse in the gym, do not assume they are just tired. Check for responsiveness. Check for breathing. If they are unresponsive, begin CPR and call for help immediately. The gym should have an AED, an automated external defibrillator. Use it. It exists for exactly this moment. 5 mistakes: overtraining, cracking your neck, holding your breath, hot showers, ignoring warning signs. None of these feel dangerous. All of them have killed healthy, young, fit people. People who thought the gym was the safest place they could be. Exercise saves lives, but only if you respect what your body is telling you. The gym doesn't care how strong you are. Your aorta does. Your kidneys do. Your brain does. Train hard, but train smart, because the strongest people in the cemetery did neither. Subscribe to glucosespy because your next rep might be the one that matters most.